Uh, yes, sir. Very good afternoon. In fact, very good evening. We welcome Professor Jayanta Das, who is the former director of NIHFW, New Delhi, and he is going to take session on supply chain management. So, on the behalf of IGNOU team, sir, we welcome you for this session. Over to you, sir.
Thank you, Professor Rita, and good afternoon or good evening, whatsoever it may be. But welcome you all, my dear friends. And as you've been told that today we are beginning to have this course that is MHH017, that is Supply Chain Management. And this is one of a kind of an invisible background of the healthcare delivery system. And why I say so, if we go to our next, sorry, introduction of it, you know, as a manager or as a hospital administrator, when you are managing the daily, working of the hospital, you need to manage basically three main resources, which is very well known, or three M's. That is man or human resource, money or the finance, and third is the materials. And if we can manage all these three, and these are the three main pillars for any management to manage any organization. And supply chain management plays a crucial role to manage one of these three resources, and that is materials management. You know, this supply chain management, or the science and art of this supply chain management, the health sector borrowed from or learned from industrial sector, but industrial sector in turn have got this thing from army. It's a very interesting thing. Almost at the end of 19th century or beginning of the 20th century, or rather you can say till that two great world wars, we people all over the world are mostly dependent on two issues, either the agricultural based, those who are in the temperate zones, but for others who are in the the tropical zones, but who are in the temperate zones, in those areas, the people, I mean, for them, either they used to colonize the things or doing it. But one thing nobody was doing, what is that? Industrialization. Slowly and gradually, of course, they started coming in after those reforms and all those things. But these wars taught us many of these management techniques, and one of them is materials management. Why I'm saying so? If you look in army, while a jawan or a soldier fighting in the front, he requires few of the things continuously. What are those things? First and foremost, arms and ammunitions. Arm is there, but without ammunitions, that is of no use, practically no use. And second thing is this: it is not only that he is fighting there, but to fight it out, he need to survive also. He need to sustain also, and for that, he require regular supply of food, medicines, water, um, the clothing, and all those things. And if these supplies are not being, made to them regular basis, the army or the soldier cannot survive in the front. And the thing is this: these supplies a soldier cannot carry, or rather, he can carry these things to a certain limit, to certain weight. Beyond that, it is not possible. It is only 14 to 18 kgs of weight, not more than that, because he is carrying that his rifle or the gun. So, to maintain that, we need to have a continuous supply chain. And for that matter, if somehow your supply chain got cut off, the army is helpless, the soldiers are helpless. So, looking into this aspect, and the success of any war depends on that how good you can maintain this supply chain. And that is how this thing came up. Though in industrial sector or in our side, we usually call it materials management, but actual term is supply chain management. And this term was basically coined through this army, and many of our nomenclatures, what we are going to use during these 4 days while we are covering this whole course, you will find many of these terminologies like logistics, like inventory. These are having that army connotation, and most frequently they are being changed, they are being used and interchanged among themselves. So sometimes we call materials, sometimes we call the supply chain, sometimes we call logistics, sometimes we call inventory. So these are the things will be there. There are finer differences are there. I mean, due course we will be discussing those things, but this is the basic background of this. Moreover, while we're talking about materials, materials are further divided into capital items and consumable items. Capital items are those items which, after procurement, can be used repeatedly over a period of time. And consumable items are those items which, after procurement, can be consumed, can be used only once or for a very limited period of time, usually not more than 1 to 2 years. And after that, they are going or taken as a consumed. Why I am telling this? Because the capital items can be repaired, but consumable items either can be used only once or may be used for some time till it is getting damaged or broken. And while we are talking about these consumable items, usually other than the items like medicines, which can be used only once, but there are certain other items in our hospitals or healthcare delivery system, like the items made up of rubber, made up of latex, made up of glass or linen. So these are the items can be used for more than one time, but not for a longer period. A linen torn cannot be reused or repaired, or it is getting, I mean, weak or faded out, or it is not in that consumable thing. Any item made up of glass, made up of rubber, made up of latex, these are also warning out. One more thing there, those are the instruments. Instruments usually don't come under the capital item because instruments are not equipments. Instruments like your scissors, forceps, scalpels. So these are the things which olden days it was the needles also, syringe needles also. So these are the things which after some time getting blunt, getting, I mean, damaged, and these things cannot be repaired so that it can be used. You in your household, a scissor or a forceps or a knife can be repaired or resharpened, but in hospitals that cannot be done, and that is usually not to be done. So that is how we divide these things into capital items and consumable items. In army, if anybody is there from army background or paramilitary background, you might have seen in your health, I mean, organizations, I mean, they, I mean, divide these consumable items or rather capital and consumable items into expandable stores and non-expandable stores. Expandable stores are any item which can be used more than once, and non-expandable stores are those where the item can be used only once, but whatsoever way it can be. So this is how we usually divide ourselves. Today's, I mean, lecture or today's discussion, we will be mostly concerned with these consumable items. Now, what is supply chain management? Supply chain management encompasses the planning and management of all activities which are involved in sourcing, procurement, conversion, and all logistic management activities. So that means it is the integration of your supply vis-a-vis the demand management. That is, the supply should be in consistence or in consonance with the demand or requirement of the hospital or healthcare delivery institute or center. Second, to do this, we need to have a good coordination across inter and intra-organizational boundaries. It is not only that we need to interact with, coordinate with the organizations outside your hospital, but within your hospital, within your among your departments also, you need to have a good coordination. It is the coordination between the store purchase department, between the user department or departments, or the financial department, administrative department. So all of them need to coordinate with each other. And hence, this is the strategic alignment of upstream and downstream patterns. Hence, as per the definition, supply chain is a scientific technique concerned with planning, organizing, and controlling the flow of materials from the initial purchase through internal operation to the distribution of their service points. Service points, it may be directly towards the patient, or maybe the users like surgeons, like nursing staff, like technicians, so whosoever working in the hospital, but for the patients and for the healthcare of the patients. So for them, these things are to be distributed. So in short, it may be defined as the management and control of goods, services, and equipment from its acquisition to its deposition. So, as I was telling, it is a backbone, or it is a silent but a critical system which is very much important and required for day-to-day activities of the patient care. Behind every procedure lies a system which ensuring the medicines and consumables arrive on time, and if, as I was telling, that capital equipments, and for them also it is functional, and resources are stocked in adequate quantity or optimum quantity. I'll be coming to this why I am pressing on this word optimum. So supply chain management is the foundational concepts and principles. It is the and procurement of the consumables, and also whenever we are having the capital equipments, it's the management of the equipments. It deals with the logistics, warehousing, and inventory, and performance monitoring and its ethics. So these are the things which we will be discussing during this course. To start with, let us have this block 1, which is the introduction to our supply chain management. This block, we will be having 4 units. The first unit, which will be dealing with basic concepts and principles of supply chain management, logistics, and materials management. What we will be learning from this unit is what are the basics of this. We will try to understand what we mean by this and how it is important for the whole supply chain management system. Second unit, we will be discussing the essential elements, that is sourcing, purchasing, storage, and distribution system. In the third unit, it is the designing and managing the supply chain network architecture. And in the fourth unit, that is roles and responsibility which are expected from a supply chain manager. As I have been told that you people are more interested for Unit 1 and Unit 3. So yes, of course, let us try to give more emphasis in these two units. But at the same time, without going to Unit 2 and Unit 4, we will not be doing the justice for whole of this understanding. So as a result, what I will do is this, I'll try to explain this Unit 1 and Unit 3 in detail, and but of course, we will touch upon Unit 2 and Unit 4 also. Let us come to Unit 1, that is, which is dealing with the basic concepts, that the definition and fundamental principles. As we have understood that what is supply chain, it is a collaborative network of group of interconnected participating units, both internal and outside the organization, that add value to a stream of transformed inputs from its origin to its end user. That means origin means right from the suppliers who are supplying the raw materials to have that manufacturing to the manufacturing unit to manufacture that item. It may be a medicine, it may be a gloves, it may be syringe needles, it may be anything, but the particularly the consumable ones. Second one is once it is manufactured, it is to be distribute. It is going to the distributor, who, along with the carriers, will be carrying these items from the manufacturer to the retailers, because they are the large scale distributors who are being giving it to the retailers. The retailers who not only getting these things from them, they are also storing this. They need to store this facility, having the storage facilities to store these items. And as and when these items are indented by the user departments, they will be able to distribute them. And third, and the last one is we need to have, along with this, the proper technology which can be applied to it, which we will be learning in detail in due course, and along with the help of the human resource. So the simple link between different components of supply chain, it starts from the suppliers that provide raw materials or components, then goes to manufacturer who produces the finished goods services from the supplied materials, then to the distributor who handles the transportation and bulk movement of the goods and services, going to the retailers who sells or provide the product service directly to the consumers. For us, these are the store departments of the hospitals or the medical store units of the uh, district or the state. And ultimately, from there, it goes to the consumer, that is the end users, who either purchase or use these products and services. So, while doing this, we find practically three important flows. First one is the material flow, that is the raw material to the end product, which includes reverse logistic also. Reverse logistics means returns or recycling. Second one is information flow. It is very, very important and crucial, because only with the flow of material, the thing will not, we will not be able to achieve our objectives. We need to have information flow and both way bi-directional data flow on the requirements, that is the demand, inventory, real-time tracking, so all these things. So we need to know from the user department what are their requirements. Those requirements will be coordinated by the store purchase department with the help of finance and administration. They will start the procurement procedure. And while we are doing that, we need to have, or we need to contact with the suppliers, with the distributors, and that the transport system, we need to have that real-time tracking. So all these things will be requiring a proper information flow, and the information flow always need to be bi-directional. And last but not the least, that is the fund or finance flow. Without money, without finance, nothing will move. So we need to see to it that the payment terms, their schedules, the financial agreements across the chain are not only properly maintained, but are also being done well in time. There are no unnecessary delays in this. Hence, the key aspects are the coordination between the departments and outside the hospital with the stakeholders, networking with these stakeholders, and value maximization. Value maximization means it is a very simple one. Whatsoever money we are spending, we need to have the maximum return of that money. So that is the value maximization we need to ensure. So that is the same thing, what is a kind of a repetition again, that is the supply chain configuration, supply chain relationship, and supply chain coordination. Core component of supply chain management. These are the five basic things which army to start with started. That is, first and foremost component is the procurement. That hospital, as per the requirement and need, they need to procure. It deals with the sourcing and purchasing of supplies from the suppliers or manufacturers. Second thing is storage or inventory management. It involves balancing the stock level to avoid overstocking or stockouts. It also considers expiration and other storage conditions. We'll be coming to the detail of it because inventory management is one of the very, very important and crucial aspect in the supply chain management. Third is logistics, that is the managing the transportation. Fourth is this, you may be having a good storage system. You have taken care of all these things. But if that store is not properly maintained, that warehousing of the medical products are not properly looked into, their the ventilation, the temperature, and all other aspects are not properly taken care of. At the time of requirement, the item may be not in that proper working condition or in a proper situation or shape which can be used. So maintenance is one of the very, very important aspect. And last one is that is the distribution, which ensures the timely delivery of supplies to the various healthcare facilities and departments. In short, the industrial sector from which we learned it and we follow, that is, it start with demand estimation. The demand estimation comes from the user department. That is, what are the requirements with the justification that why they require, and if these are the consumable items, in that condition, the exact quantity they want to have with them. So demand estimation, how it is to be prepared, we'll come into the detail, what are the scientific techniques of doing it. Once the demand estimation is gone through and it is finalized and agreed upon by the administration or the store purchase committee or store purchase department, they will go for the procurement. Procurement is a very systematic process which we need to follow so that whatsoever resource or financial resource we are spending, we are getting the best out of it. So, without compromising the quality, how best we can use our finance judicially to have the maximum output from it. Once it is procured, it will be the receipt and inspection. That means you need to see to it that whatsoever item was been demanded and subsequently procured are exactly the same thing which it has been delivered to you. Nothing new for our domestic purpose also. Whensoever these items we are I mean procuring, particularly the kitchen items, we always see to it that they are the items which exactly we asked for, and we do their physical verification. We see to it then their expiry dates. We see to it the quality checks. So all those things exactly in the same way, but in a systematic way, we have to do it. After receiving, we need to store. And as we do in our domestic, condition also, that see to it that the items which are stored in proper way, proper condition, so that there is no spoilage, no, infestation by the insects or nothing. So here also we need to have proper control of humidity, temperature, uh, pilferage, and all those things we need to look into our stores also. And then we have to issue or distribute from the store as per the requirement of the various departments of the hospital. For the consumable items, after issue and use, we go for next year or next demand estimation cycle, or the cycle is completed and we go for the next cycle starting with the demand estimation. But if it is uh, what I mean to say is that capital equipment, in that case, these equipments will go on for some longer period. So, and if we are regularly using it, we need to maintain, and as and when required, we need to repair it also. But there will be some time will come when these are not in that condition to use it any further. So under that situation, we need to condemn these items and dispose them off. So while we are discussing this equipment management, we will be discussing all these aspects in detail. And as I was telling that accounting and information flow, because through all these things at every level, we need to see to it that proper data are being collected, they are being, properly analyzed, so that whatsoever we are doing, any fault or any difficulty we are facing, we will try to look into that and try to rectify that. And not only that, the from these things whatsoever experience we are learning, we will always use it for further improving this system. And same way, this accounting is also to be done. So in healthcare, this medicine flow, that is, it starts with the raw material to the manufacturing to the distribution to the last mile, that is the physician or the hospital pharmacist. And ultimate goal is timely availability at the lowest cost, but without any compromise with the quality. As I was telling, first and foremost thing is our quality, and once that is standardized, so we will try to see to it how best we can avail this item without compromising the quality but at the lowest cost. While we are talking about the flow and storage, there are certain items in our store or we use in our hospital which require certain extra attention to be given for this purpose of storage. And these are, while we are talking about cold chain. Cold chain are those items where cold chain are required for those items where they are very temperature sensitive, like our immunization. But along with that, you will find there are certain anti-cancer drugs, certain other drugs which required to have, or they are temperature sensitive, and those temperatures are to be maintained. And not only that to be maintained at your hospital level, but right from the manufacturing to the end use, we need to ensure this temperature. So we need to have efficient movement and storage of the goods between the organizations, like transportation, scheduling, and routing. We need to see to it that they are transported in the shortest route, but they are maintaining that temperature all along. Warehousing and inventory handling, then order fulfillment and the customer service, and reverse logistics. That means whenever we are finding that temperatures were compromised throughout this period at any level, or there is some expiry, so in that case these are to be returned back. Or some problem is there, sometimes some samples are being taken to look into that quality, and while we are sending back or putting these samples for chemical analysis, or those and that analysis for that purpose, the potential analysis. So for those things, again we need to maintain that temperature. So that is kind of a reverse logistics. So in the cold chain maintenance, that is the temperature control supply chain that maintains the vaccines, biological and temperature sensitive drugs, as I was telling. Usually they range, the temperature is from 2 to 8 degrees Celsius, but there are certain vaccines which go minus 15 degree to 25 degrees Celsius also. And for that we require these equipments, that is the ice line refrigerators or walk-in coolers, that is for bulk kind of storage. But along with that, there maybe at the store hospital level, we require the deep freezer or the cold boxes and vaccine carriers for those ANMs who are carrying them to that vaccine sites. On EVN sensors, EVN is that is the uh, mm, based on the net. These temperatures are being managed. So the main authority or the person who are looking after this immunization services, they can sitting at the state headquarter, maybe at the central government, they can ensure that how this temperature at various storage centers are being maintained, whether they are ILRs, their deep freezers, walk-in coolers are I mean optimally working, the temperature is thoroughly maintained. So it is not only that we need to base on that, but with this system, and these are not a very big deal nowadays, sitting at the extreme end of the world. From there also, you can buy things, you can send your messages. So even why not we can have this kind of thing in the warfare. You can see, sitting in the long distance from US, the people are controlling this war over Iran. So even is not a very rocket science. So real time temperature monitoring can be done through this portal. Then vaccine vial monitors are there, and you must have seen that in every vial there is a circle with the purple color which changes if the temperature is not maintained or temperature compromised in some situation. So it is the last mile delivery that the challenges are there, mostly that the poor road infrastructure in rural and tribal areas, particularly the tribal areas which are in deserts or which are in mountainous areas. Then inadequate storage at the subcenter and PSC level, cold chain breakdown during transportation, inconsistent delivery schedules. So these are the things which we face. And to do this, the innovative solutions are, you might have seen the drones again. You have seen during these wars how effectively they are working. If they can do those things in the wars, why not they can do it for our health sectors also. And yes, indeed, they are doing it. And very soon people are telling even your deliveries, that is delivery boys who are bringing on your deliveries, maybe at Amazon or Swiggy or things like that, maybe I mean very soon we'll be having the drones who are doing this job. Then hub and spoke models. These are like a district headquarter who are having this, store, and they from this stores only the things are given to the primary health center, and from primary health center the vaccine carriers, they are taking the items there, and after the immunization session is over for the day, they will bring back and return the unused vaccines or temperature sensitive vials to this main store. Then community health workers, GPS tracking. So these are the ways by which we can do this. Coming to this materials management, who are mainly dealing with our um, consumable items. It starts with the demand forecast, that is predicting the requirement to avoid store shortage or excess. This demand forecasting is a very tricky job, and if we are not doing it properly, most of the time, if as it has been done arbitrarily, the two things will happen, because the chances of having the exact one will be very rare in that cases, and mostly either we land up with the shortage quite frequently, or maybe we are having an excess amount with us, and over a period of time the things will be time expired, and there will be loss of money, and there will be the audit objections that why you have bought in excess, and you could not use it and wasted our money. Had you been more, sensitive towards it, have you done it properly, you would have saved this money, which can be used for other purposes also. So yes, of course, demand forecasting is a very, very crucial and important aspect. Along with that, we need to ensure the quality control, that is inspecting on the arrival and during the storage for this, and to maintain that standard. And by doing this, we will be reducing waste. So one of the major objective of materials management is waste reduction. So the materials management, the main objective is to have the right material available in the right time, at the right place, at the right quality, at the right quantity, and definitely, of course, at a right price. As I was telling, it starts with demand forecasting. Its main purpose is waste reduction. Also, we need to do or see to it the vendor management, that is procurement and purchasing, that is the selection of vendor is a very, very important thing. And that is why I said that procurement procedure is one of the thing that we need to do it very systematically, very categorically, and to see to it that we are choosing the right vendor and who will be able to give us the items not only in the good condition or the condition in which we have asked for, but well in time and maintaining the quality also. Then inventory management, logistics and transportation, as the example of cold chain I was giving, storage and warehousing, quality control, and material handling, that is usually goes with the capital equipments. So if we can do all this, we can achieve our objectives. So we will be able to achieve better customer satisfaction, that is uninterrupted availability of the essential health products. It will ensure the patient safety, maintaining the quality through a supply chain. Cost optimization, because we will be ensuring that the quality item we are procuring, but at the lowest possible cost. Responsiveness, that is quick adaptation to the market dynamic and emergencies. Coordination and integration between the various stakeholders, and sustainability. It is not only that this is a one time procedure, because day in and day out, year after year, till the time we are continuing our patient care, we need to have this thing. So we need to see to it a robust, a sustainable system. So to do that, we need to design it properly. That means a long-term decision on the facility location, outsourcing, and information system. We need to establish these things. Only then we can, sustain for a longer period. Then we need to have a planning thing, which is a medium term, that is focused on demand forecast, inventory policies, and production. Why I am telling it is a medium term? Because every year you need to do it, and you just can't copy it from the previous year. Every year is a new year for you, and a new type of demand will be there. New type of medicines are coming in. I mean, more of your requirements will be there. So these things will be a dynamic kind of thing. So planning will be a medium term kind of thing, and operations are the short term one, that is the daily one, that is handling orders, delivering schedules, allocations. So it is a day to day business, not that every day the same medicines and the same quantity is going to be used. Every day it is not the same type of patients you are going to handle with. So for that, every day it is a new day for you, and every day you need to do it in a fresh way as per the requirement. Hence, so from this unit, what we are learning is this, that is the supply chain management is a quite a challenging one. Why? Because of its complexities and interdependence. It is not done by one department. It is not only within the hospital, it is outside hospital also. Second is globalization and specialization. So here We need to see to it that the people who are handling have not only, I mean, having that knowledge with them, but have some good experience also. It is a real-time data and system integration. So if we are not having it, you will go hayward. High sensitivity to external factors, the price rise, the adversities of your environmental conditions, the disasters. So all these things will hamper this. Then regulatory compliances and sustainability. We need to go through, I mean, lot of, I mean, regulatory or statutory, things or rules we need to follow. The Drug Act and so many other acts which are, I mean, to be followed by the hospitals for their day-to-day functioning, and we need to comply with them. Risk management and resilience, reverse logistics and returns, and focus on cost efficiency and quality of service. So, this is all about our Unit 1. Uh, I am going slightly behind schedule. I need to rush up. So, second one is Unit 2, that the elements of supply chain management. As I was telling, just a kind of a recapitulation from the previous unit. It is a regulatory compliance, which is unique for healthcare challenges, a strict adherence to the national and international regulations and standards. We need to face the supply disruptions, vulnerabilities exposed by pandemics and other disastrous kind of situations. Cost pressure, healthcare institution must balance and ensure optimum cost. This optimum word, if you go in the dictionary, it says economically maximum. That means with the cost which you are spending or the cost which you are incurring, you are getting the best result out of that. So that is how we have to optimize our cost. Counterfeit products need for blockchain and traceability. This is also another thing, and I'm sure you are aware of this blockchain activity. If not, we'll be discussing in successive blocks. Data fragmentation, that is manual request, phone calls, and others, create lot of gaps. We need to be very sure about it. Many a times we should not go by the hearsay or by manual request. Everything should be properly documented, and it should be properly maintained. Record should be properly maintained. Significance of the effective supply chain management, it enhance the patient care, that is timely availability of the medicine equipments and consumable, ensure uninterrupted clinical service and minimize the delay. It will be cost efficient because streamlined procurement and inventory practice will reduce wastage, optimize resource use, and lower overall operational cost. Risk mitigation, that is well structured supply chain, enhances emergency preparedness by maintaining adequate buffer stock and enabling flexible source strategies. Sourcing is a very important issue or important thing. And sustainability, environmentally responsible supply chain practice such as optimizing transportation route, minimizing medical waste, support the broader goal of green healthcare. And that is how we'll be able to sustain this. So key components are starting from the manufacturing, that the production of the pharmaceuticals, medical devices, and consumables need to meet the stringent safety and quality standards. So we need to see to it or ensure that manufacturers who are manufacturing are really, meeting all these stringent safety and quality standards. Sourcing and procurement. So this manufacturer, who are these manufacturers? We need to select them very judiciously, and we must be very careful while selecting them. So selection and contracting of reliable supplier to ensure timely availability of high quality materials in conformance to the regulatory norm. So it is not only that quality we are maintaining, but it is also see to it that they are ensuring to deliver the items in time. Logistics and distribution, that is the management of transportation, warehousing, and delivery of goods, including the temperature sensitive items such as vaccines, which require this cold chain system, because they, for them, not only this cold chain one, for many other things also, we need to be very careful while handling in this thing. But cold chains are so much temperature sensitive that we need to have some extra care for them. Inventory management, that is the monitoring stock level to prevent shortages or overstocking through efficient control techniques. Just in time is a system of automated thing we'll be discussing in detail. That is what is just in time, what when we'll be talking about that inventory management, for which we are having a complete unit on it. And last mile delivery, that is the final step of supply distribution. That is the right material at the right time has been delivered for the right patient. So this is very, very important for this supply chain. So as I was telling, that is the flow of the goods and service flow, information flow, and financial flow. So we need to give more emphasis on this and see to it they are properly looked after, they are properly managed. So the key stakeholders' primary role, the suppliers, that is manufacturing pharmaceuticals and medical devices, and this manufacturing has been done properly. Distributors, their role is warehousing and transportation from suppliers to the hospital. The hospital departments, that is the pharmacy, OT, nursing units, who are the end users. The regulatory bodies, who are enforcing the safety and quality standards. And the patients, or the doctors or the physicians, the technicians, who are the end users, or the nursing staff, who are the end users, are who depend on the timely availability of the right item at the right place. So the cleaning the key elements are planning and forecasting, then sourcing and procurement, production and manufacturing, logistics and transport, inventory management and storage, customer service and support, and visibility and collaboration. So these things will give the faith to the end users. And again, I am telling, it is end users are not only our patients, they are, but along with them, our healthcare workers, particularly the doctors, nurses, technicians, because they are the people who are consuming these consumables. And if these the right consumables are not reaching to them at the right time and the right place, it will be very, very difficult for them. And along with them, we need to ensure the quality of it. And from the administrator's point of view, it is the right cost for it. So as I was talking about that demand estimation or forecasting, forecasting or planning are the fundamental components of hospital supply chain management. They involve predicting the patient demand and strategically allocating the resources to meet the demand. So forecasting entails analyzing the historical and real-time data to estimate the need of the consumables, and planning involves designing the system process to ensure that these resources are available when and where they are required. So if we can do it properly, then it will prevent stockouts. That accurate forecast ensure the reducing delay in the treatment. It will control the cost. It will increase the operational efficiency. The preparedness for emergencies, because with this forecasting and from that, with your knowledge, previous knowledge, if you can see to it that what type of seasonal, I mean, disease prevalences are there or disease outbreaks are there. So accordingly, you can prepare yourself, you can have those safety stocks with you. So that will help us. And resource optimization for the small and medium entities or the hospitals which benefit from this effective supply chain by reallocating or saving the resources which can be used for other patient care and infrastructure. The problem is this: whatsoever way you may be doing it, it cannot be 100% accurate. That is the forecasting principles. So that is why the aggregate forecastings are always better, and short term is more reliable. That means you are forecasting for year to year basis, not for a 5 year or 10-year plan. And methods are quantitative and qualitative. The qualitative methods may be done by the Delphi technique survey, and we'll be coming to the detail of it, how you do it. And quantitative are the statistical methods, using the statistical methods, that is time series or causal models. So demand forecasting methods may be consumption based, use on the past in consumption, has usually been done mainly and most of the places. That is, we take the consumption pattern of last 3 or 5 years, and based on that, we do our this demand estimation. Morbidity based, that is, we go by the type of diseases which are prevalent in particular population, particular community, or particular geographical area, and based on this, we do our forecasting. Service level based, that is, estimate the needs from the number of patients served, useful for new program without historical data. So based on that, we do it. That is, what type of services are required in that community. As I was telling, that is a community based kind of thing. And expert opinion or Delphi. So Delphi technique is a technique in uh, which are structural consensus from the subcenter to the clinical expert, supply chain and clinical experts, used when the data is limited or unavailable. A new setup or a new hospital is there, and you don't have any previous data available with you. So what we do is this: we collect data from similar type of hospitals nearby or within that area, and then we prepare a list. Then we call the experts who are having a good knowledge and experience in this demand estimation. They will sit down, go through those lists, and then they will come out as per the requirement of that hospital. They will definitely look into the community, the other health infrastructure or facilities available in that area, who may be their competitors, and along with that, what type of diseases are prevalent there, and based on that, the demand or the list which have been provided to them. So with that, they will come out with this thing, and to start with, the hospital will be working with that the estimation, and then subsequently over the years, they will go by that using the other quantitative analysis method. They can uh, take the decisions for future years. So as I was telling, I'm not going to the details of it. The Delphi method, which I have said, market surveys and panel consensus. Another one is the time series analysis and causal model. I'll be telling you. But one thing, friends, at this point, I must tell you. See, you people are going to be the hospital managers. So, as a hospital manager, your duty is to look into the the requirements of the patient, the administrative requirements of the hospital, and of course, we have to ensure that we are doing it quite judiciously without losing unnecessary cost into it. For doing all these things, because these are highly technical kind of thing, and these are the things been done by mostly the statisticians. So whensoever you require this thing, you can always hire these services from these experts, and from them you can get your answers or your required information. So there is a term which I like very much, or rather a definition of management. It says Don't do the things which others can do better. That doesn't mean that you are not doing anything and always try to shift your responsibility. No, I am not telling that. But what I am telling that which are expert in nature, you always take the help of the subject experts. But at the same time, you must be thorough and clear that exactly what you want. Only then you can ask the subject expert to do the thing for you. So if you are clear in that way, so only then you can get the thing. So you know that you want to have the demand estimation for the requirement of the consumables of the hospital for a particular year. And with the data available with you, you can always take the help of a subject specialist who will help you out, and maybe with him or with her you can always say what model can be used and how best that model is useful for you. So that much of knowledge you must have, and then you can always take help from them. So don't get upset, and it is not expected from you that you will be knowing that how moving average is to be done, or exponential smoothing is to be done, decomposition method is to be done, or linear regression. It is quite common. Believe me, to be very honest, if you ask me to do all this, I will not be able to do it, and neither I ever tried to do it in my whole career of 44 decades. So be, I mean, assured. So don't get upset, but you must be knowing what time series analysis is, why it is useful, and how it can be done. Means that is what are those methods by which it can be done, not that the details of it. If you do it, well and good, but if you are not, please don't get upset. Sourcing and procurement is the next step, that is identifying and evaluating the suppliers to obtain the high quality compliant product. And second is procurement, that is the managing the transactional aspect of acquiring goods, including ordering, contracting, and payment and monitoring. The objectives of sourcing is that you need to see to it is the cost efficient, it's assuring your quality, it is assuring the timely delivery, the taking care of risk management, mitigates the supply chain disruption and suppliers risk, and strategic partnership, which we need to build up as a long-term relationship. Sourcing process, it is the need assessment, identify your need, and accordingly you do your market research, you do your supplier evaluation. From that, you select your supplier and negotiate with the supplier. Once your negotiation is successful, you go for contractual agreements. Then you have to maintain a supplier relationship management. It is not that kind of, I am telling that going for a cup of coffee every alternate day or going for a movie, but it is your business relationship, a foster collaboration and continuous improvement. Performance monitoring, you always be very agile into this. Track the suppliers key performance indicators like the delivery, how they are doing their delivery, the timely or not, the quality, the compliance. So all these things are your quality performance indicators. Then risk management, and always look for further improvement. So sourcing versus procurement is sourcing is identifying the evaluation, or that it is mostly based on market research, supplier negotiation, and relationship management, whereas procurement is purchase order, contract management, and invoice processing. So production and manufacturing can be of three types. Make to stock, that is production is carried out to maintain inventory level based on the forecasted consumer demand. Second is make to order, that is product are manufactured only after receiving specific order from the customer. First one is carried out and the maintaining inventory, that the things are available in the market. Like nowadays, if I want to buy a shirt, I will go to a shop and a kind of a supermarket or a shop and buy it a ready-made one. But in olden days, some 40 years or 30 years back, things were not like that. we have to buy clothes from the shop, then go to a tailor, and the tailor will manufacture or prepare that thing for me. So that is make to order. And assemble to order is kind like type of a carpentry shop. So you want a designer sofa set or a designer cot for you. So you will give the order. The shop, they are having all those ingredient and material available with them. So once you have given that order, they will prepare this thing for you. So that is assembled to order, where the components are produced and stocked. The final assembly is done only when the customer order or received. In our hospital also, believe me, there are certain things a hospital are producing, like pharmacy, compounded medicines. Nowadays, not much, but in olden days, we used to prepare our own mixtures. We used to have a digestive mixture known as carminative mixture. It is to be prepared freshly. There are some ointments, salicylic acid ointments. They are to be prepared at the pharmacy. Then we used to have the crystalloids, that is IV fluids. So IV fluids are supposed to be prepared in that hospital pharmacy only. Nowadays, the commercial things are available. They are better, manufactured, but along with that, that the infection control measures, particularly sterilization measures, are better done there. So that is why not much of these things are being done at the pharmacy level in our hospital. But other three departments, that is CSSD, dietary, and laundry, they are still functioning, very crucial, very critical for our hospital functioning. Then comes the logistics and transportation. The term logistics ensure that products, services, and informations are delivered at the right place, right time, right condition. So at the logistics particularly focus on micro level operations like storage, inventory, and freight, whereas supply chain operates at macro level, integrating the logistic flow. So logistics is a subset of your supply chain management, but both share the ultimate, the delivery of value to the customer efficiently. Mode of transport, we have got three different way of transport: road, air, and water. Road is a medium cost, but flexibility very high. They can go right up to the last mile. From the manufacturing unit to your doorstep, they can reach. Air cost is very high. Flexibility, well, medium, but it is a high for use for the high value and perishable items. Like the organ transplant, the organ has been transported from one city to another city. Okay. Or maybe for that cold chain one, the bulk transport of these medicines, particularly when they are coming from UNICEF or from the manufacturing unit going outside, it is to be done by the air, not by water. And water, the cost is very low, flexibility is very limited, and it is for the bulk international cargo. Inventory management, it is mainly we have to balance between stockouts and excess inventory. We need to have the optimum one. The optimization is the main art of inventory management, and while we are doing it, we will discuss how effectively and efficiently it can be done. And believe me, it is possible. So in inventory, the strategic assets are cyclic stock. That means cyclic is that regular one, that at a regular basis, at a regular interval, the things are coming. But there are certain situations which is not going on the regular basis or regular way. As such, in a hospital situation, there is no word like regular. Next day, how many patients will be coming, what type of diseases will be there, nobody knows. But over and above that, there are certain situations. Suddenly, there is some accident, some disaster, some disease outbreak, and number of patients or for a particular disease or particular event goes up. For that, we require a safety stock. And third one is the anticipation, built on known future events. That means there are certain diseases which comes in cyclical way. It is not that suddenly it is coming. We know it will be coming. In the winter season, the bouts of pneumonia. In rainy season, outbreak of jaundice, outbreak of chikungunya, outbreak of dengue. So those kind of things are there, malaria. So we need to be prepared for those kind of situation. So it is not like that. Though when the season is there, then we start, process of indenting or process of procurement of anti-malarial drugs. So in anticipation, we need to be prepared for that. So there are three type of strategic assets in inventory. That is cyclic stock, safety stock, and in anticipation you have to do. The cost of inventory, again, we'll be discussing in detail. I am just skipping it out. But other than, I mean, spending or incurring your principal cost, there are some other cost also. That is the holding cost. While you are holding the inventory with you in your store, you are incurring some cost on the base of storage, base of service, base of risk, that is spoilage, obsolescence, theft, damage. Then there are ordering cost. That is, it is the cost is not only for your item, but cost you are incurring from transport, cost, the administrative cost, supplier fee, shipping charges, taxes. So those kind of things are also there. Third is shortage cost. That after doing all this, if you could not anticipate or your demand estimation was not very good, as a result, you will be facing stock out situation. And in that situation, the cost you will be dealing with, these are tangible costs like revenue, emergency procurement, expedited shipment. So at odd time, if you are going to buy the things, you will be end up paying higher cost. And intangible cost is this shortage will give bad name and fame for your hospital, because the patient will lose trust, the reputational damages will be there. So these are the inventory carrying cost. And other techniques for the inventory are economic order, quantity, reorder level, buffer stock, and categorization or the inventory control. Techniques are there, that ABC, VED, and all. So we'll be discussing in detail. I'm skipping these things here because we will be coming back with all this. This is the visibility and collaboration. So while we are having this supply chain and the elements of it, the elements of supply chain need to have a proper visibility, that is a tracking and real-time information across all stages, which reduces the risk of stockouts or overstocking. And for that, we require collaboration, that is the trust and alignment between the hospital departments and the external partners. So these are the main, purpose for our uh, elements for our that is supply chain management elements. With this, now I come to unit 3, that is supply chain network design. Supply chain network design includes that procurement cycle, that is review the drug selection, determine the quantities we require, reconcile the need vis-a-vis the funds available with us, choose procurement method, select supplier, specify the contract terms, monitor the order status, and receive and inspect drugs. That is the procurement cycle which goes on. Procurement can be done the direct procurement or through tender buying and negotiated procurement. Friends, this procurement, when we are doing it for our hospital, there are certain items which immediately but in a very small quantity you require. There are certain items which you will be requiring throughout the year on daily basis, and hence it will be in a bulk thing. So as we do it for our home also, when we are going to buy a pen or a packet of salt, we just go there to the shop, ask whether it is available, and if your particular brand is available there, you will be very happy to take it, and whatsoever cost they are asking, you will pay it. But while you are buying, say for example rice or atta, which you require in a larger quantity, in that condition, instead of straightway buying to a shop and asking and taking it as you have done it for salt, you may not be doing it. You may not be try it out in 3 or 4 shops and find out who is giving you that your same brand but at a lower cost. That means your same specification at a lower cost, and you will buy from them. The direct procurement and tender buying is exactly the same thing. As per our GFR, General Financial Rule, that is for the public sector, and for the private sector, every private sector, they have got their own procurement rules. The procurement department follow those things. So what they do is this: for day to day, once in a while procurement type of thing, they don't go into this. At every level, they have given that power of procurement. And beyond that, that when they are having a bulk procurement, they need to follow this system. These are the open tender, restricted tender, negotiated uh, procurement and direct. Sorry, that negotiated and direct came here. That buying, tendering buying is open and restricted. Negotiated and directed procurements are the other one. That is, there are some proprietary items or negotiated procurements are those situation when there are some emergency and you need to buy it or procure it. You have run out of your stock and your regular supplier is not in a position to give it, and he is not, bound to do it also, because he has already supplied the quantity which you had asked for. So under those conditions, you have to do it, and we have seen it at the time of this COVID outbreak, where this PPE kits and those this PPE items were not available for oxygen. This kind of situations are arising, and then we are procuring by this direct procurement method or negotiated procurement method. So we will be dealing with this when we are going to it. But in short, what we are doing is this procurement method is the open tender, that large value and competitive market, limited tender with the specialized goods, direct purchase, the emergency or proprietary product, rate contract is the running one, and pooled procurement, multiple facilities buying, that is particularly it is done in a state level or in a district level. They will pool with the other government organizations or the public sector hospitals and health centers, and from them they do it. So the good procurement principles: economy, efficiency, effectiveness, ethics, and equality. So these are the 5 E's which are there. That is economy, the best value for money if we follow this. Efficiency, timely and cost-effective process. Effectiveness, right product at the right time and right place. Ethics, the transportation and accountable and fair. And transparent and accountable. And equity, that is access for all segments of population. We will be able to do it. So I'm not going to the details at this moment, because we are having a complete unit on procurement, and there in detail we will be discussing this. Along with that procurement, we need to do with the pre-purchase system, ordering system, and post-purchase system. Pre-purchase system, the particularly when you are tendering it. So you have given your own specification and terms and conditions. Some of these terms and conditions may not be very clear to the potential vendors. So they will like to discuss these things. So instead of doing it one at a time, why not fix a date, call all of them, they will discuss, you will explain them what exactly you want, what are the purpose of your organization, what the items you want, and what quantity you want, and approximately what other specifications you are having. If they have got any query, those can be resolved then and there only. Many a times it is found that the thing which you have asked for are not exactly available in market, or things usually don't go by that way. So you have got some chance to rectify it. So now by rectifying, you are publishing your tender, notice, and based on that, they will participate. Then once it is done, the ordering system is there, and after all thing is done, the post purchase system is that you are reviewing the things and see to it whatsoever you have found any difficulty, any deficiency, and you will rectify to make it better in the next time. Warehousing management is a best practice, that is FIFO unit, when you are stocking the items, just to ensure that the things are not unnecessarily getting expired. We have to ensure that first expiry, first out principle. The items which have got the earlier expiry are to be distributed first, and the longer expiry will be taken later on. Then we need to ensure the storage condition, that is temperature, humidity, light contracts. Good storage practices we have to follow, and stock counts. So we'll be discussing in these things in detail. We'll be going. So warehousing and storage, we have to ensure the physical facility, proper coding and classification of the orders, items. We are having a separate unit for it. First in, first out policy. Some people say it is the first in first out, but it is always better to first expiry first out. But some places they call FIFO is rather more, practiced one, or more popular type of thing, but actually it is the first expiry first out. Monitoring of the expiry drug, for which you need to maintain an expiry drug register and see to it that entries are not only been made properly, but at a regular interval they are checked into it. Every month it will be seen that what are the medicines mentioned there which are going to be expired in next 3 to 6 months, because every hospital or every health center have got their own policy in this. But this to see to it that those drugs which are entered into that page, those you find out the stock and ensure that within next 3 or 6 months, that period been given. So within that period, you will be able to consume them. If you are not, take action then and there. Talk to your supplier if they are ready to take it back. And that is again, I was talking that reverse, supply chain, that reverse logistics. So you can talk to them, or you can put that kind of clause in your supply order only. So if well in time you are contacting them, they will take it back. And maintenance of stock and other registers other than this expiry drug register, you need to maintain those things also. Other things are facility designing, capacity planning, and resilience. That is optimal placement of the warehousing and forecasting the future demand, and accordingly you have to increase your capacity and building a network that can survive the pandemics and disasters. Governance model, centralized one or decentralized one. Centralized one, obviously you are going for bulk purchase, so that is how the unit cost of the items will come down. It will be very easier to control and standardize the quality, and you may have, but it will have the longer lead time, because the bulk purchase or centralized thing, administrative work will be taking slightly longer one. Whereas in the decentralized, the services are faster, particularly to the last mile, high local responsiveness. You will be very particular that exactly what you want, because if the centralized one, the supply will find some of the items which are not required are being pushed to you, and some of the items which were very much required but not given to you, and you have to go for local purchase. But in decentralized one, it will be the operational cost will be higher. Similarly comes the push and pull system. Push system is forecast driven. Push system is that it is a centralized way when the things are being procured, and from there it is pushed down. At the district level, the items who have been procured, or maybe at the state level, all the items are being procured and they are making the kits. In the kits, the same type of drugs are being given to the district level, and from district level further these kits are distributed to the primary health centers and sub centers. What happens when this kind of things are being done, a centralized one, a master list is being prepared, I mean, without taking care of that a particular district may be having a particular type of disease prevalence, or they are in the coastal area or in the hilly area where their health requirements or the demand for this health issues may be slightly different. But as it is in the push system, as a result, what is happening, there are certain items which are not required are being given to them, and certain items which are very much in demand for them are being given, either not given or given in a very small quantity. Whereas the pool system is a demand driven, where as per your requirement you are taking this is. So push is most on the forecasted kind of thing, and pull is as per the demand type of thing. So there are certain items in your hospital also you will find they are common for all the departments, but certain items they are very department specific. So we need to keep those things in view. That is, what are those items which can be combined and we can go for the bulk purchase, and which are those items which are department specific and we need to have them as per their specific requirement, we procure them. um, that is the supply chain in Indian major health programs like immunization program, then national TB program. So all these things are there. I've taken it from your book only. uh, we may skip these things. Counterfeit and substandard medicines, and reverse logistics, as I was telling. And then supply chain sustainability and ESG, that is, supply chain also depend on environment, social factors, governance factors, and it is the circulate that economy reduces the waste through reusable packaging, drug take back programs, and other sustainable things. Um, Skipping this also, the supply chain resilience, robustness, agility, visibility, and recovery. So yes, of course, your whole system should be very robust, but along with that, we must be agile, that is speed of response to the unexpected demand surges or supply shocks. So those kind of things we have to take it. You have to be visible, that end-to-end transparency, and recovery, the capacity to restore the normal operations should be there. So there are data driven, I mean, supply chain decisions making are there. That is data to action cycle, that accurate data form from LMIS. We are having a complete um, unit on this. We'll be discussing, I think it will be on the last day we'll be doing it. Analyze, identify, decide, act, implement, all these aspects. Then human resources for supply chain management, particularly that, as I was telling, that these people should be supply chain professionals, not only, I mean, having a good knowledge of it, the store management, but along with that, they have got good experience also of doing it. But to enhance their capacity, we need to have training at the regular interval, particularly how to handle this logistic management information system, good manufacturing practices, cold chain management, data analysis skills. Along with that, role clarity, that is clear SOPs and all, and retention challenges. So these are the other global partnership and organizations with whom we have to do it, and the Indian specific partners are also there. who help us in this supply chain management and integration and all these things. And this is emerging trends in health supply management, that is artificial intelligence and machine learning, blockchain traceability, drone delivery, circular supply chain, and digital twins. Trends, these things again we will be discussing in detail in our successive things. Here I am just introducing you because this first block is particularly for this introduction one. Coming to this role of manager, so roles and responsibilities are it should be enhance the customer services, curtail production cost, elevate product quality, enhance financial stability, and formulation of optimal marketing strategies. These are primarily the roles and responsibilities of the supply chain manager. So supply chain process, that is he need to ensure that the demand estimation is being done properly as per the requirements they have received from the departments. Management of inventory, they should ensure that they have been done in the most scientific way. They should ensure the quality control measures. Whatsoever supply they are receiving, they will ensure that the supplies are in best quality. So along with the supply, they should always ask for quality certificate from them. But not only that, with the quality certificate, they can start distributing. But at the same time, they should draw the samples, and usually 10% of the total inventory of your store, and should be sent for chemical analysis. But they should do the physical analysis of those things. There are certain institutes where they do biological analysis, but at the hospital level, we don't require that, but only that physical verification to be done for all items, then chemical analysis of the 10% of the items, and then we have to go through it. If there is some discrepancy, some physical damages, or chemical analysis report is not good, immediately the further distribution to be stopped. You must withdraw all the supplies from your dispensaries and those areas, distribution areas, the wards, and you should contact the supplier, and the supplier should take back that stock and replenish with the newer one. But we need to see to the quality control once again. We need to ensure that business administration, he should ensure that procurement and sourcing procedures, chain logistics and delivery. Along with that, he should be doing that strategic thinking, analysis of data and decision making, communication and collaboration, and he should be a master to solve the problems. Whatsoever problem he is facing, he should try to solve them, maybe at his own level or maybe at the administrative level, whensoever it is required. The key performance indicators for this are the inventory turns, that is the total supply spent over the average inventory. Benchmark is 3 to 5 annually, the inventory terms. Fill rate, that is the lines filled on the first attempt over the total, it should be 93 to 98%. And on contract spend, that is the negotiated spend over the total spend, minimize the variation. Digital supply chain management tools, that is the enterprise, um, that is the ERP system, that is enterprise resource planning system. It is again a computer based or web based kind of system. For this, this Oracle or SAP and so many other systems are available to do this. So it is the integration of the business processes, artificial intelligence or machine learning, and all these other things are been there, and we'll be discussing in detail at the at the subsequent in the corresponding unit we will be doing it. Emerging trends are control towers, that is a holistic end-to-end view of the performance monitoring. That is, we need to regularly emphasize this. These are the fancy names been given. But actual work is this. We need to always on our toes to see to it that performances are properly monitored. Blockchain, that is temperful records for prevalence and security, and other clinical integrations. So, friends, in summary, that is supply chain management is a lifeline of clinical services. Success relies on five rights of the materials, that is the right item at the right time, at the right place, at the right quality, right quantity, and definitely at the right cost. Digitalization is the key enabler for the visibility, and that is why all these things are there. So things maybe at the upfront, the person like us, like me, who are not very familiar with this technology, maybe slightly, afraid of. But believe me, that the experts are available, the agencies are available. We need to hire them. We need to take the services from them. But the end word or the short point is this, that we need to, very much vigil, and ensure that we are tracking all these aspects properly. And management requires a mix of technical and soft skill. So both these things are required. It is the knowledge from your part, from the part of the administrator, that is what exactly he is supposed to do, what exactly he is looking for, and then the soft skill, that is if he can do it, nothing like that. If he is not, he can always take help from the subject experts. So friends, with this I stop here. So it is open for your questions. If you have got any question or thing, you are most welcome.
Hello.
Yes, please.
Good evening, sir.
Very good evening.
Sir, as you are working in the health and welfare department, I would like to ask a question about during the COVID crisis, there
Mm-hmm.
were a severe shortage of oxygen cylinders, drugs like amphotericin B. How did your
Yes.
department manage that situation? Also, what measures were taken to prevent people from panic buying and overstocking essential medicine and supplies?
Good question. Thing is this, as you have signed all around, it was a very panic situation. The thing is this, that is why I was always telling you the sourcing and procurement procedures. Many of the hospitals were caught in that situation, that they have identified the source, they have identified or the manufacturer. But the thing is this, the demand was so high, and the manufacturers were not in a position to produce that much of supply. Under that situation, it is beyond control for anybody. So there is no such thing like that, that everything can be done. But yes, of course, we can learn the lesson from that, and we can ensure that yes, there are certain plants or things like that. Like many of the hospitals, after that, they started having their own the oxygen generating plants. Many hospital had that thing. They are not, depending on the cylinders or the bulk supplies of oxygen. So they are starting having that oxygen generating plant, so that at that kind of thing they can start, producing their own. But on the other time, because these other things, they have got another problem also. You have invested that much of amount, but requirement is not even 50%. Under those conditions, it is a loss for that organization. So they need to see to it that other than that patient care, what other purpose this oxygen can be used, and is there or are there some buyers for that or not? So those kind of issues we need to take care. Similarly, it is for the medicines also. But that was the time when we definitely realized this thing, because it was not an epidemic, it was a pandemic. It is not like that. Okay, the Haryana government is not able to have it. We can have it from UP government or Karnataka government or state of Tamil Nadu or state of West Bengal. Not like that. Every state, every community were equally affected by that thing. So those are slightly difficult situation, difficult thing. But the lessons we have learned is this, that under this kind of situation, what other aspects we have to take care. But definitely, yes, of course, as you are telling, if the things are in a high demand, even the supplier will not be able to do it. Any other question?
Thank you, sir.